All right, cool. And then a little bit about the influence of that analysis in 3 specific areas of the plan: the policies, kind of our process, our community engagement, and then our prioritization. And then, sort of how data is really essential for you to gather, to understand as part of this analysis process. All right, a little bit of context. So the city of Gresham, of course, is on the east side of the metro regional area. There's a large conversation about displacement in terms of minority people, people of low income being pushed out of North Portland, Northeast Portland, where prices are rising. A lot of them have been relocated to the cheaper housing in Gresham, East Portland especially, but Gresham is definitely part of that story. You can't see the line where Gresham and Portland stop. People just live all over the place there, and it's very similar. So the first yellow spot there, close to the Portland border, is the city, the town center of Rockwood, and then the next one is Gresham's actual downtown center. Rockwood is, out of the 38 metro designated areas, Rockwood is really the most diverse in the region. The median age is 27, almost 50% are non-white, and my last statistic was, oh, that's bad. Okay, and there's 70 languages spoken there, and has the lowest per capita car ownership across the region as well. And again, in those town centers. So I mentioned Multnomah County was our funding partner and really helped us be our technical advisor on how to integrate equity into our planning process. The grant funds came from the Center for Disease Control through their REACH program, which is the racial and equity approaches to community health. So, why would health funding make sense for a transportation plan? Well, of course, it's an active transportation plan, so you have that sort of connection between health and transportation. But really, when Multnomah County looks at health, they're thinking about things like, what are these preventable causes of death, and what can the health department do about that across the county, right? So we're getting population-wise. And you look at these leading causes, and all of them are preventable and treatable if you increase, if you better people's nutrition and their diet, if you focus on steering them away from tobacco use, and if you increase their physical activity, right? So you have to have all these things happening, but you can affect these different chronic diseases. So that is one of the main reasons why it's so important. And then because REACH is specifically targeting African-American populations and how they are overrepresented, right? So in cancer, heart disease, diabetes, stroke, they're overrepresented. So the REACH program really targets that specific minority population and tries to, do interventions that will then lead to better outcomes for them overall. I mentioned that sort of displacement story, the gentrification that's causing people to move into East County and into Rockwood. We do not have the same built environment out there. In North Portland, there's a lot of street connectivity. There's opportunities for you to get to your destinations close, your church, your grocery store, your school, your park. You can walk to all those things. You have a basic grid. East County is not like that, right? We have wide arterials. We have lots of cul-de-sacs. So there's just a big difference in that change, which changes the opportunities people have, right? They don't have the same choices to get to where they want to go. All right. I wanted to frame equity a little bit, just so we kind of have a shared definition here at the presentation, how we were thinking about it in our project. So, equity is about fairness, just like equality is about fairness. But our approach is really to be thinking, is everyone getting the same outcome? Right? So in the graphic picture here at the top, you can see how you could distribute resources equally. You can give everyone the exact same resource, and that can influence their mobility, for example. But not everyone really has the same outcome, right? A little girl can't ride as well. Person with a disability may not be able to ride at all. So your populations are starting with, they're different, right? They start from different baselines, and they have different abilities, and so you have to take that into account. So really, you want to distribute your resources based on equity and give people what they need, so that you end up with essentially the same mobility for all your different groups. All right. So what is a racial equity analysis? So it's an intentional systematic review, of how different racial and ethnic groups, you could have different demographic groups, are going to be affected by a decision or a project that you're putting in place. And the whole idea is you're going to examine the inequalities and try to figure out what can you do to eliminate those inequalities, mitigate the inequalities, and prevent kind of this future disparity between people and groups. So starting off, we weren't exactly sure how to do that, but luckily others have been doing these kind of equity analyses in different areas. We used 2 different guides to kind of help frame how we were going to approach our plan. Portland's Partnership for Racial Equity, they have a racial equity strategy guide, and then Race Forward has a very nice, compact list of things you should be asking in their racial equity impact assessment guide. So both of those are tools that really provide us the questions that we need to start asking. So they don't just tell you exactly how to do it, that we had to learn that. It was challenging, but it was, I think, in the end, successful. So core questions that those types of things ask, is, what racial groups are going to be impacted, how, what's your evidence of inequality, is your proposal going to reduce these disparities, what are the adverse impacts or unintended consequences, who's been involved, and who's missing, how could they be involved? So the idea is you're asking those things at different places. We encountered that really best practice is to, start this early, build it into your whole plan. You can't just sort of say halfway through, like, oh man, what about that equity thing? Is that important here? We should look into that. So really, you got to think about how it's incorporated from the beginning. Because it's an analysis that I think also really forces you to be iterative to some degree. You have to do the work and then say, if our proposal does have unintended consequences, if it has some things that are negative for our group, what are we going to do differently? You can't just keep plowing ahead and kind of say, okay, well, that one's not very good. Right? So you got to be willing to adjust a little bit. And then, of course, a key point is that you really got to do it before decision points, right? Because you need your analysis, you need to be able to understand how your decision is going to affect things, and do it before you actually make that decision in the process. All right, so when we looked at sort of the elements of our plan, which follow very much generic planning elements, we really figured that the policies, the community engagement, and the projects were really, or project prioritization are really those key parts where we're going to emphasize the equity analysis. So why did we pick these pieces? Of course, policies, they really guide the plan, and they guide any future considerations. So once we have policies in place about health, about equity, we can, anything else we do around walking and biking, we can turn to these policies and say, well, remember, we adopted this. This is really important. This is how our city views this. So it really governs that future as well as this specific project. Community engagement, of course, our plan, the goal is that we're helping people walk and bike better in Gresham. And we want to make sure that we're affecting a specific group, African Americans and other minorities. And if we don't include them in our planning process, well, then how do we know if we're actually, we're having our intended consequences? How do we know what they actually need and what the disparities are for the groups? So super important that our community engagement was going to figure that out. And then our prioritization, because prioritization, you get a big project list from your projects, and you're thinking, well, these are all the things we could possibly do in transportation to change things. But you really have to prioritize because you never have enough money. And prioritization really determines, sort of where and when your improvements are going to happen. And so that sort of temporal aspect to it is super important, because if you have an analysis that says we should be helping this group, and then all of your projects that you're going to build in the next 3 years are somewhere else in your city, obviously you're not making any improvement. So there we go. That's our key decision points. Let me turn for a second to our policies. So our first example. The project goals, we have access to healthy food, we have access to physical activity, and then there's this racial equity emphasis to it. And we proposed 10 different policies. Our previous planning document, our transportation system plan, had 5. This one really specifically has 5 that call out these ideas around our project goals. So for, again, health, physical activity, physical activity and equity. And I want to point out 9 and 10. I mean, it's really where you get into the meat of it. And this is completely new language for Gresham. This is not something that, I think we would have got anywhere close to without our REACH funding and our Multnomah County partners helping us understand the importance of, sort of changing the dial for specific minority groups. So again, it's about, increasing mobility and accessibility for underserved communities, by ensuring that the network is accessible through, or is improved through equitable investments, right? So that's really important to us now. The other big example we have is with community engagement. As we were setting up our project, we had this challenge where the city really wanted to go out and talk about 2 different things. One, we wanted to talk about this big redevelopment project, which is on a 5-acre piece of land in the heart of Rockwood. It's called Rockwood Rising. You can see an architectural rendering there. So that was one project that was kicking off. The other thing we wanted to talk about is we wanted to talk about walking and biking. What are all your barriers to getting around? We also knew that through conversations with other activities in the area, sort of like East Portland's action plan, TriMet's work on the Division Transit Project, there was starting to be a lot of community fatigue. And people didn't want to come to an open house and give their same opinion about transportation again, or about development projects. So we were really concerned that we weren't going to get the public input we wanted, and we weren't going to get it from the groups we wanted, right? We really wanted to make sure that we were getting input from the communities that we're trying to affect. So instead, we had to think about a slightly different way to do that. And in setting up sort of our call for consultant teams, we integrated. We said, you've got to do this differently. We've heard about Portland, hiring these community liaisons. They're really people from the community that are then going back into the community as experts to talk about the plan you're working on. So that's what we required, and we had some really good responses. We ended up working with Design and Culture Lab and the Rosewood Initiative, which is right on the border of Gresham and Portland. And so we were able to work with them to really find some liaisons that were going to be able to go out into the community. And they did end up actually talking about, we had 2 groups and they trained together. We had 6 active transportation liaisons, we had 4 Rockwood Rising liaisons, and they really went through this learning process over the summer every week through these trainings to help them understand city government, what the projects were about, how do you gather data, how do you talk to people, things like that. So this is some of the things that they worked on. Their job was to, once you kind of know something about the active transportation plan, they know a little bit about walking and biking, we said, okay, what do you think? What's the best way to start reaching out to the community of Rockwood? How are we going to get people's input? And so their job was to come up with events and think through what's going to be attractive to the people that they knew in the community. So in the end, we had some really good results. They threw 3 big community events. They went and did 77 interviews at different sort of community parties and things that were happening. They actually went door to door and just knocked on people's doors and asked them questions, which I would say is pretty bold. Not something we do in a typical planning process. They created a documentary film because they were really interested in sort of the personal stories of how transportation affects people getting around, what their normal mode of transportation was and how difficult it was. And then they led 3 community walks to sort of, show off the barriers that they had identified with the community to different groups. I think, again, they were hired to reflect the community. So, we hired people like Basim, who's right there with his cell phone, who speaks Arabic. We have Luz, who speaks Spanish, and Emmanuel, who is African-American, and Beatrice, who was a teenager, right? So we're really trying to get people who are going to go out and be able to interact with similar communities, and it wouldn't be intimidating for the people they were approaching, and it wouldn't hopefully be as intimidating for them. Here's just a couple more examples of the stuff they're working on. So that documentary film, the community walk, they went out to National Night Out. They did a lot of tabling and trying to explain what our project is about and get people's feedback. about what the barriers that they faced were. All right, so here's some of that feedback in terms of barriers. I think what's important to point out is at the bottom half of the slide in the black part is, these are all things that are directly related to the built environment, right? So they're all things that in theory our plan can start to influence and address. We definitely did hear some things that we weren't expecting, right? Personal safety, police behavior. Some people listed personal safety as like, well, I don't feel safe because some of the streetlights are broken and it's dark there. And other people were like, I don't feel safe because the police intimidate me. It's like, wow, that's a really big problem, but it's not one that we can necessarily solve in our active transportation plan. But now that the city is aware of it, the city's doing other things. So we hand that off to like our police department, and they do, coffee talks now out in the neighborhood. And they're trying to get this idea of a different way of policing and a different sort of interaction, people's expectation of how the police interact with them. They know it's a problem, so they're going to try and fix it. So that's really good. You don't almost get the input you're expecting from things. And I think the other thing that we heard that I want to point out is that we definitely heard that there's a need for some education, partly for rules of the road. A lot of immigrant communities live in Rockwood, and the question was, what's safe for bicycling? What's the rules of the road? And how do I access them? How do I tell my friends who don't have as much English proficiency as me? So that's a challenge, going to be a challenge for us. The other thing we heard is that, people they don't know how to use the rules of the road for basic bicycling. They also aren't going to understand things like a green bike box, right? Or a bike signal. And so as we roll those kinds of things out, we're going to have to really pay attention to how we introduce them and how we frame them for people so they can be accessible and they'll use them infrastructure in the correct way. So, all right, I'm going to pass it off to Mike.
Thanks, Jay. All right, so I'm going to switch it up a little bit now to start talking about some of the data and analysis we did that informed the plan moving forward. So we really started with a really intensive data gathering process. We ended up creating this atlas with about 60 different maps of the community of Gresham. But today I just want to talk about a few of those that I think were really the most informative and that we used throughout the process. The first is our equity index. This is kind of a composite map with populations of low-income populations, communities of color, and then the youth and senior population, including median household income and the non-white population as they're traditionally underserved populations, and then youth and seniors typically have higher mobility challenges than other age groups. So you can see this map really focuses attention there on Northwest Gresham, as Jay was mentioning, Rockwood, as well as other areas of the city that we weren't as focused on. You can kind of see those other red areas with higher needs. Another big focus of this plan was access to food. So here is our map of food stores. I think the story here is those orange dots. Those are your kind of traditional supermarkets. You can see there's about 11 or 12 in the region, but there's only one in that Northwest area right there. And that's serving the entire area north of Division, east of 222nd or 223rd, and just that one supermarket. And right as we were kicking off this process, there was another supermarket, and it had just closed in that area. You can see from some of these headlines, Rockwood was already considered a food desert by the federal government's guidelines, even with that other supermarket. And with that reduced, it is now the only option there. One of these articles had an interesting finding that PSU students went out and looked at prices at all the supermarkets in the metro region, and they found out that that supermarket in Rockwood actually had the highest prices for food essentials. I think the picture there is clear. There's no competition. Even though it's a poorer community, they would have to go miles to find other supermarkets. So not only did they not have options, they were now kind of getting gouged by the prices there. This next map, this is the bike network of Gresham. I think the first thing that pops out to me when I look at this is a great network. It is completely connected, good spacing. There's facilities throughout the city, but the problem is when you start to look at what these facilities look like on the ground, there's something like this, a painted bike lane on a 5-lane arterial with speeds often upwards of 40 miles per hour. So even though there's a great network in terms of connectivity, it's in the actual comfort of it is very poor. So we decided to take a look at the network a different way using level of traffic stress. This is analysis some of you may or may not be familiar with, but the idea is rather than looking at facilities, we look at how does it feel to ride a bike on that network. So the green lines are something that anyone of any age or ability would feel comfortable biking on. Yellow is a little bit more stressful, but anyone that knows how to ride a bike and is probably around at least the age of 10 would feel pretty comfortable. I don't think you'd want to learn how to ride a bike on those streets, but once you do, they're pretty comfortable. The problem is when we get to these orange and purple streets, they get very stressful, high speeds, no protection, and people don't want to bike on them unless they're really experienced cyclists. So you can really see a ton of the network now is that orange and purple. So we no longer have a complete network. This is the same map, just overlaid on a map of communities of color. And you can see there, even in areas that have a larger percentage of people of color, there's even worse facilities. There's really only those purple and orange facilities. So there's almost no low stress facilities in those communities. So bear with me on this next map. It takes a little bit to get your head around it, but I think this really explains the problem we're trying to address. So this map is showing in color every low stress facility in Gresham. So there's actually a lot of low stress streets in Gresham. These are your neighborhood local streets. There's not that many cars, speeds are pretty low. But then each color group is where you could get on those low stress streets without having to go onto a high stress street. So what you really see now is these are islands. If you wanted to have a nice quiet bike ride and not have a stressful interaction, you could only kind of go in these little circles within your neighborhood. You can't actually get anywhere. And even kind of the one larger group, this pink color, you can see it has a few nice connections because there's two great regional trails, the Springwater Corridor and the Gresham Fairview Trail. But really to connect them, you'd have to go out of direction to get onto that trail just to get to another neighborhood. So I think this really made the focus for our moving forward with bike projects is we have to find a way to connect these so people can actually access destinations, access healthy food and options for physical activity. Moving over to the pedestrian side, this is a map of sidewalks in Gresham. It's kind of hard to see at this scale, but I think the takeaway is Gresham actually has a really good sidewalk network. There's a few gaps you can kind of see on the areas there, and then the west side where there aren't sidewalks, but by and large, the sidewalks are pretty good. But when we dug into it, we realized the problem wasn't walking along the street in Gresham, it's walking across the street. So this was an analysis of all the crossings in Gresham, and we did kind of a similar thing to the level of traffic stress. We did we looked at how comfortable would it be to cross the street. So those green crossings are going to be very comfortable. And then when you get up into those orange and purple crossings, they're not going to be very comfortable. And you can see, again, these huge lines of those along the major arterials, along Division, along Powell, along 172nd. So really for the pedestrian side of projects, we knew we had to focus on these crossings. So here's a look at the projects we came up with on the left side there for bike projects. And so what we tried to do here is we're not going to take away the existing bike network in Gresham. We're not going to rip those bike lanes out. But we realized we need to create kind of a second network that's available to people of all ages and abilities. And so that's what this network is showing. These are streets. The idea is to be low stress streets that anyone would feel comfortable riding on, similar to the neighborhood greenways in Portland for the most part. On the pedestrian side, you can see those purple ovals. Those are where we targeted our crossing projects to really help. Especially, you can see there those the blue rectangles are food stores. So really focused around getting people safely to food. And then also the purple lines are our sidewalk projects. So we've picked out a few kind of key areas that need sidewalk infill. There's a couple of gaps along Division and one along Burnside that we identified. Before turning to prioritization, I'll talk a little bit more kind of about about the bike network and choosing these projects. As Jay mentioned, there's a ton of cul-de-sacs in Gresham, a ton of disconnected streets. Really, the only streets that go through long distances are those arterials that are all scoring LTS of 4 or the worst quality. So we had to try to avoid those. And it kind of meant getting creative, looking for things like this that people already knew about. You can see they've put down wooden boards to stay out of the mud and find this cut through that really increases connectivity. So here's an example of one of our kind of project sheets for these bike routes. And for the most part, it's making use of those low traffic streets that are already calm. They don't need much investment, just some signage and maybe some traffic calming, but they're already there. The key then is how do we get kind of across the arterials and to get through these disconnected street networks. So some of those treatments you see on the right were some of the things we came up with. For example, it's kind of hard to read, but we have one that's going through actually a private parking lot. Is the only way to get through this part of town for over a mile without going on a major arterial. So it's kind of a creative solution if we can find the right design for it. Some other things were going through schools and parks, basically anywhere that already had trails that people could bike safely on, making use of those. And then the blue line in the bottom, you can see at some point there are arterials that are going to be avoidable. And so in that case, we often proposed a 1-block protected bike lane. So people would be able to cross safely, get on a nice facility for 1 block, and then get back on the lower traffic streets. So turning over to prioritization, these policies these criteria we used all came out of the policies that Jay spoke about before, promoting safety, health, equity, as well as access to key destinations and transit. And so putting those all together, these were the ones that rose to the top. And you can see most of them are focused around Rockwood and the west side of Gresham. As for the bike side, we had pretty much the same criteria, one different there being connectivity. Again, trying to get across those islands of connectivity I talked about, they need those connections, and so that was a key criteria for the bike network. And here were the top projects that coming out of these criteria, a couple of key north-south routes through Rockwood, as well as east-west, and then one down there, BR10, which is kind of a route into downtown from East Gresham. And then the last criteria that wasn't tied to the policies was public input. And again, we just, as Jay mentioned, we through all the work with the community liaisons, that's really what we leaned on here. So any projects identified by those groups that have been working with us for the duration of the project kind of instantly got the top criteria for public priority. And I think it's just interesting to note, though, here, even as you can see, they're all rose to the top, but even without the public input, those were already the projects that rose to the top, which I think just reflects well that the way the policy led into the criteria reflected what the community was actually looking to get out of this project. And with that, I'll turn it over to Jay for a few conclusions.
Thanks. All right, so a couple things about process. We learned, like I said, we didn't know exactly how to do this when we started out. And I think one thing we found is that it's not necessarily linear. There isn't an amazing roadmap that you just kind of work your way through and get it done. It took a lot of sort of meetings where we just sort of ask those questions. What are the unintended consequences of this policy? Are there ways that we're not being effective with this bike route that we're putting in here, and just kind of working through that as staff. I think we definitely found that again, it's not a checkbox, this equity analysis. You really have to be a reflective practitioner. You really have to try and understand who it is you're serving, and what potential impacts are you going to have when your plan's actually done. And I think one thing that Multnomah County really did a good job of is helping us try to develop this shared definition of equity so that the project team was all on the same page. And ideally, that's something we would have gone out and even done more with in the community. I got to say that equity can be kind of a touchy word in Gresham. A lot of people out there, they don't quite understand why the city would prioritize minority communities over anyone else. They're like, well, that doesn't seem fair. What about me? I pay taxes, right? So how you approach that conversation can be very delicate. And, I think in the future, we could probably do a better job at that, even of making it a little more broadly reached. In terms of results, I think when you think about the impacts that equity will have on this plan, especially long-term, as we start to find the funding for the bike routes that Mike talked about, find the funding for the sidewalk infill. I think we've hit that part on the head. We've figured out how to put equity to help us with our policies. I think we did a good job with our engagement, and then the prioritization is really going to, again, help shape things for the long term. I think we did a great job at analyzing data. Alto was, superb at that and helped us through sort of, what are the questions we're asking here? What can we really pick out of, our demographic profile? Man, that thing's huge. What's really the important pieces? And then, again, this was a whole new way for Gresham to approach community engagement. It definitely is, it raises the question of why aren't we doing this every time, and how can we start to do that better with other projects? Is it just planning projects that need to have this, or are there other projects within the city that should have the same kind of outreach strategy? So I think I'll leave it at that and leave it open for questions.
Thank you.
Thanks.
How did you decide what weight to give the community input? And how is that quantification process approach?
Yeah, that's a good question. I don't have the exact approach in front of me, but so yeah, there were a ton of different events, but I think the thing we brought to the top was anything coming out of the community liaison groups. So they would go into the community and kind of come back with, here are the projects that our community said are most important. So since they've been with us the entire project, they've been learning alongside us, we kind of put that to just our top prioritization. In order for other input sources to hit that, it would have had to come from multiple things, say our online open house and in-person outreach from multiple people. So we really weighted that the most, and then just kind of all the other sources we fit in somewhere along the spectrum.
You mentioned you got a little pushback from the community, and the process could have been more dynamic and engage people in what is equity. But how did you guys kind of deal with the pushback and not dilute, keeping true to racial equity goals?
I think you're giving us more credit than we may deserve. I think what happened is we ended up tailoring our message depending on our group. So if we were out speaking to an elderly, all-white group of a neighborhood association, we had one message about what does equity mean when we're saying we're going to, prioritize these routes and talk about, how they're going to help the city. It's sort of like, we've placed these routes all across the city, so that's a really good thing. How the prioritization happens, it was a little harder for them to grasp, and I think that because it was a little technical, it did kind of escape people sometimes. What they reacted more to was really, there's a bike route in my neighborhood. Do I like that or not? I have parking problems in my neighborhood, so how's this gonna affect me? Oh, I have a sidewalk gap. I like your plan. I'd much rather have you, complete the sidewalk gap. So, that's the kind of thing that people were able to react to better. So again, the whole conversation, the community conversation about equity was not very strong. And I think it's because it's a challenging one. On the flip side, if we were talking to Rosewood Initiative, right, who is basically an advocacy organization in the neighborhood, and they bring all kinds of service providers together to help people who need help in their neighborhood. It's completely different. We were able to say things like, we really want to prioritize, these routes because we think it's important for, people of color to have good access to food. And I don't think we were being duplicitous necessarily, because I think at the same time we have to consider that we know that regionally from regional surveys, the people who use active transportation, so walking and biking, taking transit for their daily needs, right? So this is like, because I need to get somewhere, get some food, something like that. That the highest population group of doing that is people of color. So again, we know that we're aiming in the right direction, even if we haven't figured out quite how to explain that to everybody else. I saw your hand first, right behind you. Go ahead.
Did the cost of the various improvements factor into your prioritization at all? On some things that might be a high priority might be extremely expensive, whereas something that's a couple notches down, a little bit less expensive just to implement. Did that figure in at all?
Do you want to talk about that?
So we didn't factor cost explicitly into the prioritization, but our entire framework of creating this network was that Gresham is not going to have the funds anytime soon to build a network of protected bike lanes on those main arterials. So we were trying to avoid them and have the idea that every project is going to be reasonably low cost. that we're creating. Although we still, one of them and one of the top priorities is this right here, which is right along Division. And that's going to be an expensive protected bike lane, but from everything we saw, we knew that we needed to have that, and there was no alternative project there.
Could you talk a little bit more about what the specific improvements are on the map that we're looking at right now?
Yeah, so and so we basically most of them are going to be bicycle boulevards is the idea. And so basically each project got a sheet like this where we're identifying the local streets that we thought were the best route, and then the trouble spots. Where are you going to have to deviate? Here's where you need a 1-block protected bike lane. Here's where you need to figure out how to get through a parking lot. Here's how you get through a school. But for the vast majority of that is all going to be kind of a bicycle boulevard neighborhood greenway treatment.
I just generally would love to hear more about what work you did with transit access, but I'm specifically curious if you are working with TriMet to identify any like maybe tough service spots, or if you analyze like the spatial difference in access to TriMet stops.
Yeah. So I mean, that was one of the policies, and then one of the prioritization criteria was providing access to transit. So we certainly looked at anywhere where there were sidewalk or crossing gaps near transit stops. So that went in both into the project identification here, and then also into the prioritization.
Will you be recommending any what did you dive deep enough to making the recommendations to TriMet or partners with them to increase or improve service to different areas?
No, we didn't. So we use transit access more as a measure of, are we putting these projects in the right place? And if they have better transit access, or they provide better transit access, we want them to rise to the top. But what really governs TriMet service is their service enhancement plan. So we engage with them in other ways, just around that in general. And then, TriMet is just starting, I found out, kind of rethinking the pedestrian network analysis that they did about 10 years ago. So they're going to be, re-looking at the region, their region as a whole. So we didn't find that transit stops were a specific focus for us, and I think it's just partly challenge of scope. We certainly could have gone through and emphasized, where are the good stops, the bad stops, where the sidewalk exactly, is needed, but we just couldn't in this one.
And just, if that's something you're really interested in, I would check out their pedestrian network analysis. As Jay mentioned, it's starting to get old. I think it's 2012, but there's a lot of really good stuff in there. A lot of thought went into that.
So this is, I do somewhat similar work, of more project specific than plan, like entire city plan. And I know that one of the challenges is you can only do so much in an active transportation plan. We had that pie chart that had over half of the things. We're like, well, we can't really do anything in this plan. But then also, at least half of the things at the bottom of that pie chart are things that are not necessarily being directly addressed in your recommendations either. Like personal safety, traffic might be, but might not be, depending on the type of recommendation. This is a type of pushback that I've gotten a lot in doing this outreach, where you show up and people are like, why are you even building this? What we really need is such and such over here, which is completely out of the scope that I'm doing. And then people will specifically folks from communities of color, low-income communities, youth, will have requests or ideas that are even further from what project funding or project scope I have at that moment. So it's something that I've struggled with, and from what you're showing, it looks like that was at least part of your process, even if you had a little more agreement. I'm wondering what some of your strategies for working with that are, or trying to adapt to be able to actually give the community what it's asking for.
Yeah, I think that, I totally hear you. I mean, that's challenging. And so that was part of the concern around this slide, is this sort of like, the community is telling us that they're like having these, they feel oppressed by the police. Like, oh my gosh, like there's no way we're going to answer that. But we can at least route it to the appropriate person. I think, we kept track. There's hundreds of comments about places where it's like, you should be doing this with the bike network, or, and it's like, wow, that street is, way off in the hillside, has very, the people who ride it are like only wear spandex. Like that is not a priority for this plan. But we want to keep that input, and we want to at least kind of know about it. So I think that's the thing, is at least helping people understand that you're like, well, this is how we can track it. This is how we want to keep track of it. I think that takes a little bit of process. You have to have a system in place to be able to catalog that input. And I think data is the other thing. People might be like, I've got to have this crossing right here, and if you can point to like, well, look, actually, this is where the safety issues are occurring. We have the data to back that up. This is the treatment that makes the most sense. I appreciate that you want to be 300 feet away, but like our network analysis shows that actually this serves the most branches of this network to get to a main location or a main destination. I think backing it up that way, even if they don't agree with you, you've justified yourself and you've presented your best argument. That's about it. Yeah.
So we have a question from the web. So is this method being used in other parts of the planning process besides transportation? And how is it being coordinated across the different domains?
And when they say the method, they mean specific
The equity
to
analysis.
equity analysis. Okay. We have not. I know. Like Metro, PBOT. They've taken on like big, bureau-wide sort of analyses of how do we deal with equity. Are things fair? How do we treat people? Is there systemic bias? The city of Gresham has not gone to that level. We have started a more like a grassroots group within the city of Gresham that started some trainings, brought out trainers to start talking about that kind of stuff. So I think there is positive momentum, but it's not going to be encapsulated in sort of a big policy document, at least right now. And I think the conversation is starting to grow. I think this is one thing that really helped raise it within our department of planning, urban design planning, kind of the concept of equity and where are we on that. And if we all agree with it, then how come we don't have a plan about it? Or how do we, insinuate it into our everyday practice, even if it isn't, a plan in place that requires us to do it? So I think it is starting to raise the conversation.
It seems to me that one of the big challenges in equity is first getting people to show up. So once you are sort of a city that's decided to take this on, the process of beginning the engagement, but then on the other end of it, continuing that conversation and sort of building on that momentum. Can you speak a little bit about the challenges that sort of bookend this particular process?
Yeah. I think if I got your question right, it's like, how do you keep it going, right?
How do you keep it going and how do you get it started? So
yeah. I think in our particular case, what got us started was the grant funding and the fact that CDC through Multnomah County, that's their focus, and it's sort of like, yeah, you're right, that is important. Like, we have other policies just sort of about health, bicycles. Let's make sure we have access to healthy stuff, right? But it's not specifically focused on equity, and so we wanted to make sure, we see some of those connections. How do we strengthen them and make them better for our community? So I think that helps a lot. Is that when you're funding, your goals are often tied to your funding, right? So your funding is going to dictate a lot of what you're starting to think about. So I think that was really important for us. And I think what's great is that we have staff. I mentioned that other big development project in Rockwood Rising. So their staff they received REACH funds as well. They had community liaisons doing outreach. And one of those staffers is super passionate about equity and wants to make sure that the conversation is better in Gresham and that it's more thought about across all bureaus. And so, she's one of the people that's been leading this sort of like, let's get some trainers out here. Let's, let's make sure managers will allow people to come to these. Let's talk about this. But absent that kind of enthusiasm, I think it's a lot more challenging. And I think you'll need some kind of outside force, whether it's grassroots agitation, a city staffer who's excited about it, a funding source. You'll need something outside that'll kind of start to drive that wheel.
Yeah, I think another challenge is sort of fatigue in some sense of a community, right? The sort of engagement across issues, the multitude of issues that are encompassed in equity. And so I guess back to the previous question, thinking about, so let's say there's a housing plan happening, are there mechanisms to take that social infrastructure that was developed through this process and keep it going in a way to make it so? Do you see that it might happen?
Yeah, it's great. The Design and Culture Lab, our consultant who was out there hiring those community liaisons, was talking about that right from the beginning. They're like, it's really great that you guys are taking this approach, and we'll help you set it up. But how are you guys going to use this long term? Like, you've invested all this, money basically in creating these people who are they're almost could be leaders in the community, maybe, right? Like, at least they have this connection to the city that that community hasn't necessarily had before. So you've invested in your community, but like, how do you keep it going? And what's your plan for that? And then the city's been struggling with that. We've had in the past sort of community committees for everything. Volunteers just show up. That's kind of we've seen its decline over the years, right? People are not excited to just show up to a boring meeting every month. So it is a city council work plan item. How do we redo community engagement? What is our plan for that? So they have hired a consultant to sort of think about that. And what is it that meets our state obligations, right, around planning and around sort of civic engagement in general for the whole city. But then also, kind of does it in a way that it's going to work for the community and for us.
So during the planning and design process that you undertook, do you look at any other networks, either in the region or across the country, for examples of like creative solutions to those connection issues, or did you mostly manage that stuff in-house?
We certainly are always looking to other cities, for example. So my company, which is tasked with coming up with that network, works all over this country and the world. So we're kind of just tapped into that. We're able to kind of bring up problems and just shoot company-wide emails. Who's encountered this? What are your thoughts? What are your ideas? So it's not like we haven't specifically went out, just kind of drew on that expertise.
Yeah, I'll tell a little story briefly. I remember, we thought from this is that I was like, maybe what we need is like a little appendix that tells us what are all the different design options, like what's out there, like, I don't know, if we build the right stuff, is it going to show up? Katie Mangle, Mike's boss, was just like, you don't need that. There are so many of those. Just go pull one off the website, And so it's really important to have a consultant team that can sort of understand your needs as a city and be able to recommend, where's it worth it to put their effort? Because there's a limited amount of time you're going to have your budget.
From the map, there really was a good network, like you had both said. So as a part of the solution, did you ever discuss just doing an awareness campaign or something like that? So you have some billboard that said, like, better together, like we all live here, something like that. Addresses the people driving in the car, like on the pie, that's the pie of community engagement. One of them was inadequate, like sidewalks, and that's a perception, right, from it. I'm perceiving this as inadequate because the cars are driving by very fast, but it could be adequate if the cars were driving slower, if we were all like on the same page as a community. So was doing a campaign ever discussed as a solution?
It is an idea. So our active transportation plan's on our website right now. It's kind of our draft version. We're working on our final, which will go to council this fall. But we have an implementation chapter, and it's trying to cover these questions. Like, well, now that you know what you know, how do you get it built, and what's really effective? We did look at programs kind of briefly, safe routes to school programs, bike encouragement programs. What has the city done in the past that we should carry forward? Because it's going to take a long time to build the infrastructure. At the same time, you really want to be building your bike culture. Right? You really want to get people thinking it's totally okay to be a pedestrian here. Here's your safe streets, go use them, get yourself to transit. Like, we want to encourage that. So we didn't look at how to do a really specific one, but it was an idea in the implementation toolbox.
I need a question.
That's right.
So at the beginning of the presentation, you showed the graph comparing white and African American preventable causes of death or whatever. Do you know how the other racial minorities compare in that? Is there consistency across the board, or are they kind of all over the place? Do you know?
Let me see if, I will say the notes, this is one of the county slides that I'm not as familiar with, but in Kamisha's notes, it's, African Americans and indeed many communities of color experience disproportionate rates of chronic disease, right? So that's as much as I can give you. Is that it's common, right? But I couldn't tell you exactly.
So as a graduate student at Portland State, did you take many classes in community engagement? And if so or not, how did your education kind of prepare you for this particular challenge?
I don't think there was an actual course in community engagement, but it's talked about a lot. And then I worked at TriMet, which was nice because they have a whole kind of department that does community engagement around. Like I worked on the light rail project, so it was able to kind of see what their strategies were, how they got out in the community, what they did. So that's where I learned most of my stuff. And then, you work at a city or at a firm and, they have a way of doing things and it's evolving because how you reach out to people does evolve. And so I think that helps a lot. It's just, gaining some of that experience.
I also didn't have a specific class in community engagement, but I think the best experience I had was through workshop. We held all different kinds of events, and some failed spectacularly and some went well. So I think I learned a lot from that just kind of trial by fire.
Great. So what I hear is we could do a better job of incorporating engagement into our curriculum. And I don't think we do it at all on the engineering side, am I right? Yeah. Something that I think, especially as if we're going to be serious about equity analysis, we need to start here, right?
Yeah. Yeah, I know you should send your engineering students out with you to your job where you've got to go explain the community improvement, what it is.
So specifically for you, we had some speakers come to the engineering department from TriMet last term, I think it was, and they mentioned specifically about the Milwaukee Light Rail line and how they felt that involving the community on that project and the way they did was extremely successful. They felt like it, and they felt like that ended up in lower construction costs and pushback from the community the way they did that. Were you there during that process? And if so, how did that experience, your experiences there, how did that translate to what you did during this project?
Yeah, so I was there for some of it. I was there towards the end because the whole outreach process starts years in advance. But I worked in transit-oriented development, and so we were looking specifically at parcels that the agency had around stations, and could they be developed in certain ways, and what did the community want? And so we attended Portland. Portland was conducting a whole series of workshops that were about land use changes, basically because of the light rail line, but not, so that was interesting. We were able to attend all of those and kind of find out. I think one of the, just like you heard that there was, community fatigue over going to meetings. I've seen planning staff set up like 30 boards, and there's like 12 staff members there, and there's all this time, and you end up with 12 audience members. People come through for this open house for a 2-hour period. And you're doing something wrong. And it's not just about getting your message. It's not just about sort of saying, do people know about this? It's because that's not the best way to engage them. And so, it's hard. It's hard to figure out what the other way is. And that's why we chose to copy Portland's other method, which is, going out, taking community members, seeing what they thought was the best way to engage people. So yeah, it's, I think seeing those things happen and realizing that that kind of standard open house model, community meeting model may not be the best way to do it. And you've got to find other ways. Even if you catch people for 5 minutes on a Max platform, maybe that's more informative of your project to them and sort of their input about, their challenges in transportation than you're going to get, by, having a web-based, click menu, or by having, this open house that they never attend, right? So, yeah, it's challenging though, and I think it'll continue to evolve.
something that is different about that too is if you're meeting them where they are, you get a more diverse perspective, whereas like people who are coming to an open house, they already have a preconceived notion or they already have buy-in. Whereas like if you're meeting more of the general public, you're getting, again, like I think a more diverse set of opinions about things because they didn't come with a plan in mind to talk to you about at an open house. So.
I think that's totally true. Yeah, there's self-selection bias, right? I've got a workshop that's set at this time. Who can actually attend that at that time? Who has, can surmount the sort of childcare issues, dinner issues, any transportation issues to get there, and yeah, is it important enough to them that they're going to come with an opinion? So yeah, I think you're totally right. You get a completely different set of diverse opinions.
Great. So I think with that, we'll thank Jay for the presentation. So next week we have Martin Leitbergen from Utrecht University, who's a visiting scholar here with us this year. So we'll see you next week.
You can hit stop sharing as well. You need to go into.
So appearances, somebody said, would you like to?
Feedback.